Hey, it's Dr. Allin here at Evolve Chiropractic in Woodstock, and I'm going to give you 5 tips for success in your treatment plan to help you get the best results possible. First one is going to be frequency. So when you come in, we give you a prescribed plan. Typically that's going to be 3 times a week. Now what we do is we prescribe these plans based on the best results that we see in our patients. This is based on research and also clinical experience in our office itself. So if we prescribe 3 times a week and you start coming 1 time a week, you're not going to get that result that you want. So we understand that it's a time commitment, but we also want to make sure that you get the best result possible. So you have to push yourselves a little bit. You got to step outside your comfort zone and you have to show up. And I always tell patients that's the hardest part, is showing up. Once you get here, you get into our office, our jobs are easy from there. So showing up, that's number 1. Number 2, traction. So based on your x-rays, we've prescribed a form of traction for your therapy. Now, whether that's pain relief or it's corrective, the traction will be extremely important to the success of your treatment plan. Now, with traction, it can be a little bit uncomfortable. We're stretching your spine into a direction that it does not want to go into. But what we know is that position that we're trying to get you into is the one that's going to be beneficial for you long term. So we want to reconnect your brain to your body and your body to your brain. And to do that, we have to put the curves back into your spine the way that they need to be. And the best way to do that, based on research, clinical experience, is using these traction-based therapies. So it is a little bit uncomfortable, kind of like getting braces on your teeth. When they tighten those braces up, teeth get sore, sometimes get little headaches. But it's important that we work through some of that discomfort to get that long-term results, which is what we're trying to achieve. So don't skip out on traction. If you can push yourself maybe 10% more each time, if you can add another minute or 2 onto that traction to get you to that 10-minute point, that's where the changes start to happen. Icing afterwards can be very helpful as well. So make sure you're icing, you're doing your traction therapies. Number 3, home care. So outside the office, you go back to your life. We go back to gravity, we go back to old habits. What we're trying to do is create new habits. We want to create new movement patterns. We want to train the body that it's safe to go into all these directions that we're training you in the office. So at home, anywhere from 2 to 3 times a day, we're going to start to implement some home care. It could be something as simple as breathing exercises, range of motion. As you progress through your care, that's going to start to turn into more isometric, like postural exercises where we're strengthening certain sides of the spine. And we're also going to be working on stability exercises, getting to our core muscles. The more we do these and the more consistent we are, we're going to actually start to create habits. Because what we don't want to happen is you come in, you do all this work, you get better, and then you go back to exactly what you were doing before you came in. We don't want to practice insanity, we want to practice ways to get better. So we want to create new habits. So right from the beginning, start carving out that time for yourself and you'll see the results really quickly. Number 4, hydration. If you don't like water, that's gonna be a problem. We have to make sure our bodies are adequately hydrated so that they heal appropriately, that our tissues have elasticity, flexibility, and the inflammatory fluids that are hanging out in certain joints, those can become diluted and we can start to push things through the body a little bit better. Hydration is one of the most important aspects, and so many patients come in here and they're not drinking enough water. So in the beginning, what I tell people is I want you to overhydrate. So drink way more water than what you're used to. Yes, you are going to be going to the bathroom more often. As your body adjusts to the more fluids and starts to retain some of that, you're gonna go less. So make sure that we're overhydrating, especially in the beginning. You wanna aim for half of your body weight in ounces of water. So if you weigh 100 pounds, you're drinking 50 ounces of water per day. So very, very important, keep drinking that water. Again, we're making habits. We have to retrain the body. Number 5, nutrition. All right, so what we're doing is rebuilding the body. We're in a rehabilitative process. We have to provide the body with these building blocks that it needs to rebuild itself. All right, so that's gonna require us to eat whole foods and anti-inflammatory foods. We have a 30-day program that we have developed for all of our patients, free of cost, where it lays out an entire 30-day meal plan of anti-inflammatory foods. On average, people that go through this, they'll drop 10 pounds in that 30-day process. But also what they're doing is they're providing that body building blocks to repair itself as we're pushing it through all these new ranges of motion. We're creating space and we're getting the body to heal. So we want to make sure we provide the body with the best opportunity to rebuild itself. And that starts with what we put in our mouths. So these 5 tips are going to set you up for the best experience in the office, get you the best results as quickly as possible. Hopefully this helps. If you have questions, feel free to ask any of us in the office. We'd be glad to help you out. Be safe, have fun, get at it. See you soon.